Hello, NAAOP members and friends. It's the last week in August here in Washington, D.C., and this is usually a time when Congress is on congressional recess, what they like to call a district work period, but what others would call a vacation, while the rest of Washington gets a chance to settle down and take a little break itself. Not this August. During these times of congressional recess, the federal agencies usually are quite active in issuing regulations, and the last 2.5 weeks have been no exception. There have been two major developments that have occurred in the orthotic and prosthetic field over the last 2.5 weeks. I'm going to relate them to you today. The first is that CMS, the Centers for Medicare and Medicaid Services, announced round 2 of the DMEPOS competitive bidding program. This is an expansion of the existing program from 9 cities across the United States to 91 additional cities, making a total of 100 of the largest cities across the country that will now be competitive bidding DMEPOS, durable medical equipment, prosthetics, orthotics, and supplies. However, most prosthetics and orthotics are exempt from competitive bidding. The one exception is off-the-shelf orthotics. CMS was considering bidding off-the-shelf orthotics in round 2 of the program, and NAAOP and the other major O&P organizations worked together and campaigned to have CMS not include off-the-shelf orthotics in competitive bidding for very valid reasons. The fact is that orthotics and prosthetics is much more clinically oriented, service-oriented, and customized to each individual patient, and simply doesn't lend itself to competitive bidding the way more commodity-based durable medical equipment might. We're grateful to CMS for deciding not to include off-the-shelf orthotics and off-the-shelf orthotics in competitive bidding, but we do recognize that there is work to be done in this field, and that CMS needs to pursue in order to implement the existing federal law and regulations involving O&P care. The second major development that occurred over the last two weeks, in fact last week, was the issuance by the Office of Inspector General for the Department of Health and Human Services of a report entitled Questionable Billing Practices for Lower Limb Prosthetics. This is obviously never a good thing when the OIG issues a fraud and abuse report on your field. In this instance, the OIG found, for instance, at least $61 million of payments that were questionable because the physician involved in ordering the prostheses had not submitted a Medicare claim, him or herself, for the past 5-year period. This brought into question whether physicians were paying proper attention to the prescription of prosthetic care, and raised the issue of whether these devices and services were medically necessary. One of the recommendations of the OIG in this report that CMS is interested in is the requirement for a face-to-face physician visit prior to a claim being paid for orthotic or for lower limb prosthetics. This is a double-edged sword. It is an issue that we need to address in earnest, but this is the type of solution that is really a DME-based solution. A similar requirement exists now for the prescription of wheelchairs and other DME items. We have a different approach. There are many other ways that we can regulate orthotics and prosthetics, and that really goes to enforcing existing law, making sure that states that have O&P licensure statutes, that CMS recognizes those and doesn't pay claims for unlicensed providers and suppliers. Also recognizing accreditation status and making sure that the suppliers that provide orthotic and prosthetic care to beneficiaries of Medicare are qualified to do so. We're going to continue to work on those issues all throughout this coming fall as the joint committee that is looking at entitlement reforms and Congress address Medicare and Medicaid entitlement spending in a very significant and substantive way. And we will do our level best to keep you informed with what occurs as developments arise. Thanks so much for listening, and we'll see you on the next webcast.